Content warning, slight blood. So I got top surgery on December 19th, 2022, and this is how it went. Day of surgery, I was so excited and nervous. The nerves didn't really hit me until the night before surgery, so they kind of caught me off guard. But anyway, we left and got to the surgery office. I met all of my team and my personal nurse, took all the medicine that they gave me, which was 3 pills, anti-nauseant, anti-inflammatory, and probably an antibiotic. They gave me my IV and took a tube of blood along with a urine sample. They gave me some Versed, which is an anti-seizure medication, calmed me the hell down, and soon enough I was in the operating room. I scooched over onto the table and lied down. I heard my surgeon say, "Today we're doing a double mastectomy," and then was put on oxygen. He then looks at me and says, "Alright, we're about to start putting you on anesthesia, so get ready." And I'm like, alright. So then I passed the fuck out. I'm not even gonna cap, y'all. I passed the fuck out. But 2 hours later, my surgery was done. I was awake for about 30 minutes or so before they brought me back to my room because they had to monitor me for an hour. Anyway, I got dressed with some help from my roommate, and then we headed home. There were a lot of naps today. Day 2. I spent a lot of my time with my partner lying down. We set up a system for me to get up because I can scooch, but I do need some help to get from a 45-degree angle to a 90-degree angle, but if I'm upright then I can do almost anything else alone. Day 3 was the worst of the days so far. Pain, spasms, and more, but my meds were so fucking good, y'all. I ain't even gonna cap, that shit was bussin'. I took a good ass nap and then I got up. I started getting my appetite back and enjoyed the rest of the day resting. Day 4 started off swimmingly. It was the best day so far. So I started getting up and moving around, doing some little things. Tried making a video and then the nausea hit. I guess I pushed myself too much, but up until this point, all nausea was hunger nausea. But it couldn't be that because I had been lightly munching on Fruit Loops all morning. So I lied down to chill. Who cares if I feel mentally bad for not doing anything? I'd rather feel physically okay. I didn't end up vomiting though. Oh, and this was the first day I experienced being cold again. Day 5 was the most normal day so far. It was like functioning before operation, but just limited in motion and connected to 2 drains. But also, today was the snappiest I've been yet. Very impatient. And the nausea came back. Took a nap before I would have thrown up because I wasn't looking forward to it. But I never did throw up. But today was the day that I learned that my meds for muscle spasms were what was causing the nausea. So this was the day I decided I'm gonna stop taking everything else other than my antibiotics. I have Tylenol. I'll be fine. Right? Day 6. I'm so fucking itchy. Oh my gods, please end my suffering. But I'm pretty much back to normal functioning. Of course I'm still limited on range of motion, but I get better every day, living like nothing ever happened. Day 7. I put on a shirt. Like an actual shirt, like not a button up. All by myself. But today was just a normal and average existence. Day 8, I had an interview and I got the job. Everything else was average as per usual. Look back at the past few days. Day 9. Today was fucking amazing. I had my first post-operative appointment. As my female doctor was taking off my bandages, I watched my chest get flatter and flatter, and I started to tear up. And she patted me on the shoulder with a grin, as if to tell me that she was there for me, or that she understood, and that it was okay. And I really appreciated that. But I got my drains and stitches removed, which, by the way, that didn't hurt, like, at all. It just felt weird. But most of all, I got to see myself shirtless for the first time. I can't even begin to explain how amazing this felt. I thanked my amazing surgeon, and I can't even begin to thank him enough. I'm gonna move on because if I don't, then I won't shut up about that. But on the ride home, I felt the seatbelt lying flat on my chest, and that was absolutely amazing. You wouldn't think that something like that would make a difference because it's an everyday thing, but it definitely does. Anyway, I have a follow-up appointment in mid-February, and I'm not supposed to raise my arms above shoulder level until then. I get to take off my own bandages, as well as do my own scar care in a week. Nipple care happens 3 times a day when that time comes. Neosporin will be my best friend. But for now, I get to wear a compression shirt and feel amazing about how flat my chest is. Day 16. 2 weeks post-operation. Today's January the 4th, 2023. Today was a very big day. I walked around completely shirtless for the first time in the comfort of my own home, and I can't wait until I do that in public. I took off my nipple covers and started nipple care, which is just applying first aid ointment. I think it's called Bitracin. Neosporin will do. You just apply that to your nipples 3 times a day. My chest looks amazing. According to my surgeon, my nurse, and my EMT of a mother, I think my chest is perfect, and the healing is really nice. Up until today, though, I did think that my nipples were too high on my chest, where you could just look and tell that I'm trans, but that was a ridiculous idea. I compared mine and my boyfriend's chests, and they're nearly identical. My nipples are just bigger than his, which is okay, and that's not something that I'm dysphoric of. They look really nice. Today was also the first time where I've been okay with being fully naked. Yeah, I still have some bottom dysphoria, which has gotten better with time. Thank you, testosterone, for bottom growth, but I'm so proud of my chest and how far I've come in these almost 8 months on testosterone. I sincerely am so happy with my results, and I'm very proud of how far I've come in such a small amount of time. I look at my process and I can't help but smile, but anyway, let's go ahead and wrap this up. Well. I know that this topic is going to draw in a specific audience and educate my current audience, and that's really my motive for making this video. If I can educate a curious person or someone willing to learn, then I've done my job. If I can help another trans person considering top surgery by educating them on what my experience has been like so far, then I've most definitely done my job. I hope you learned something, and trust me, this isn't going to be my last video on this topic. Expect a follow-up video similar to this around February the 10th, but I will be doing another video on top surgery soon enough. You'll see when it comes out, but I hope you all are having a wonderful year so far, and I'm wishing you all the very best. Have a great rest of your day, and peace out, my fellow Rainers.